Good morning, good afternoon, and good evening. I'm privileged to have this opportunity to address you. I am Oluchiri. I'm the Chief Executive Director for the Sunrise Study in Kenya and the Executive Director of Wellness for Greatness, the organization entrusted with leading the Sunrise Study in Kenya. I extend warm greetings to you all, including colleagues, friends, and members of the Sunrise community representing over 60 countries. Today, I have the honor of sharing our journey with the Sunrise Pilot Study in Kenya and highlighting its significance within the broader international Sunrise Study. Our journey with the Sunrise Study began through Dr. Antonio Palmeira, the Executive Director of the International Society for Behavioral Nutrition and Physical Activity, ISBNPA. In 2021, he introduced us to distinguished Professor Tony Oakley, marking the start of our involvement in the Sunrise Study. However, the hurdle of securing funding posed a significant challenge, causing a delay in commencing data collection for over 24 months. Fortunately, the Sunrise Coordinating Center, with the support of the World Cancer Research Fund and Cancer Australia, provided the necessary support for us to conduct the pilot study. It brings us great pride to share that our pilot study's data collection phase could conclude this month, and we are optimistic about the promising leads for main study funding. As many of you are aware, the core objective of the Sunrise Pilot Study is to assess the feasibility and acceptability of proposed methods of the broader Sunrise Study. This pilot also serves as a catalyst for co-creation and establishment of a global network of researchers focused on the 24-hour movement behavior of young children, a cause that resonates with the Wellness for Greatness mission of cultivating an active society by empowering the youngest generation. In terms of our approach, even before procuring the requisite funding, we engaged with key stakeholders, including Kenya Ministry of Health, which paved the way for vital partnerships. Dr. Maureen Cheserek from Egerton University played a central role from the very outset. A direct result of these initial endeavors, working closely with our research team led by Stephen Tanui and the rest of our dedicated team, and under the guidance of Professor Oakley, we effectively organized data collection training in January and conducted the pilot study data collection between June and August of 2023. Our preparations encompass a variety of actions, mirroring the standard practices of most Sunrise study teams globally. These actions include the process of obtaining ethical clearances, securing the necessary research permits, and actively seeking endorsement from local government authorities to ensure a strong foundation for the study. Concurrently, we initiated school recruitment efforts, reaching out to various child centers with the goal of collaborating with five schools to yield over 100 participants. Our pilot study was marked by some unique challenges and some not so much unique. They include, first, unforeseen political disruptions. The emergence of political demonstrations in June and July brought about a significant disruption in school routine, casting a considerable impact on participant recruitment and engagement, particularly within the urban environments. To manage this challenge, we prioritized data collection from our urban child centers initially, recognizing the susceptibility to disturbances caused by these demonstrations. Subsequently, we transitioned to rural areas where interruptions were less pronounced. Second, timely transition. We initially trained in January of 2023 with the intention of starting data collection shortly thereafter. However, due to unexpected factors, the actual data collection was postponed to June, resulting in a significant gap. To address this gap, we organized an online and later on-site refresher course in May. This refresher was crucial in keeping our team prepared and capable despite the extended time between training and data collection. Third, navigating parental consent. We encountered parental resistance at some child centers, with last-minute refusals to grant consent for the study. In both cases, the research team swiftly convened meetings with the parents. Through transparent dialogue, they effectively conveyed the study's significance within the broader context. This engagement not only addressed their concerns, but also transformed the initial reluctance into support, highlighting the power of open communication and collaboration overcoming obstacles. The heart of our pilot success lies in the handful of vital elements, which include, first and foremost, engaged school administrators. Capitalizing on our well-established school network, we were able to secure the active participation of school administrators, which played a pivotal role in the success of the pilot study. Secondly, clear study introduction. At the start of the data collection at each center, we extended an invitation to all participating parents. During the sessions, we carefully explained the study purpose, addressing any questions or concerns they had. This approach facilitated parents' confidence granting of consent. Third, seasoned data collectors. Supported by our closely knit team of experienced data collectors who have cultivated a strong rapport over time, the data collectors integrated with parents and children alike, fostering an environment conducive to effective data collection. Fourth, personalized parent questionnaire interviews. Recognizing the need for precision and reliability, we adopted a personalized approach to engaging in one-on-one interviews with parent participants. This decision, rather than sending out printed questionnaires, significantly contributed to standardizing and enhancing the accuracy of responses. Fifth, structured schedule. Following an initial week of data collection, we tailored and adhered to a customized schedule. This approach streamlined our data collection process, optimizing its efficiency and effectiveness. As we transition to the main study phase, we envision first, leveraging datasets, utilizing pilot study datasets currently being prepared by the Sunrise Study Coordination Center to engage key stakeholders. Secondly, planning and fundraising, strategizing and fundraising for the main study, building on our pilot successes. In conclusion, our journey through the Sunrise Study pilot study in Kenya underscores the resilience, adaptability, and collaborative spirit. Challenges were met with strategic solutions, from prioritizing urban data collection to addressing parental consent concerns through transparent dialogue. As we transition to the main study, we leverage our insights and partnerships to propel us forward. With gratitude to the Sunrise Study community, we embark on a new phase dedicated to advancing children's well-being. Asanteni sana. Thank you very much.